Iqaluit, everyone. It is Thursday, April 15th. Thanks for coming and tuning in so quickly on such short notice. As usual, Premier will start us off with an update, then Dr. Patterson will speak to the next steps about the situation in Iqaluit. Minister Iqaluit will end us off with something at the very end after questions. So let's get right into these openings, then we'll go into questions, one question, one follow-up. Please maintain very strict social distancing. There's hand sanitizer in the back. And thanks again.
Ulla sakkullumi sitamek April 15 kuyanemi kaigunnagat sikilami yukkun taimatsay na sivulakti kalimalawluni luta Patterson kalimalangan medyo ikalunni kanuilok tohangamma Minister Kusuga nungwan kalimalangan medyo malatok sukatakon na lang medyo kanigilo at tele katang ako si amalo avani agkatsil titali
Nunavut ubla tsako pahi ubla ngo yotan ataw nuban na yo kalang may gapta Nunavut iluani tabani kalung ni lunin dana te ay tumito hawang ilaw lo tu kinakawi may na law tu tana nuban na yo nunaling untika katamer tu loman kihena korea li yung atakwa Nunavut mutat 13,937 kapayaw himala matata nuban na jo tare gutimita ni hudla pa kapayaw mi amatakwa 10,128 king uliani kapayaw himayud nuban na jo tare gutin amma unnu okalawa matauta na akalung miud 3,600 akalung miud hibudla pa mi kapayaw himayud amma 2,000 ta king ulami magawak sa kapayaw himalak tutan na nuban na jo tare gutin akalung ni kaw himayung atakwa inuit amihud ihumaluk tut amma naluyut kanu pinialang mga tana hungito tana ihumalung naktuman kiheni takwa anya tailitichikut maliktaw ko yung malitsa optigut ulang itugut at ay tuloy lang inapta tana anya narawit ay himalutit amatakwa igloyo abi iluani itu taikwa kihimit mana katigit talaw lugit ani gowit kina pamit matwami atok talotit man na ulwak tu ata takwa overlook takwa malik taw ko yot maligaka tabut ay toloy lang inap takwa ilagi yabut pekanna yabut inna kotibut nunalibut takwa meneret chalawit takwa malit chalawit ay toloy lang inap nuban na yata nirmi kihani takyami hung nutana utak kayabut mana pangna khimana khawteme le kaptata nuban na yo pijitigilugo kiheni takwa malik taw ko anya talichi kuni malik chalaw labon amatakwa awe amiuta tiane tukulaw mata takid hitamapata nuban na yo kalaw tilugit ma takwa awe amiu ayung mata takwa taw kalung ayungin yan tamap talukta cheme takwa malik taw ko yaw anya tailiti malit chalaw labut malit chaw tigutana ay toloy lang inapta amma kingul la pamitana nunabun miut kapiya nuban na rata re kutimi kapiyaw himang inagobit mana anya mo kaluglutit kapiyaw yak to na putit tana nuban na rata tare kuti moderna tana ayung itcharto kapiyaw lukta opta nunabun miutigut anya lilang inapta mat na nunabun miut. Good morning. Today we are reporting one case of COVID-19 in Iqaluit. This is certainly not the news we wanted, but it was always something we knew could happen, and we are prepared. Thankfully, 13,937 adult Nunavut have received their first Moderna dose, and 10,128 Nunavut are now fully vaccinated against the virus. As I mentioned in the news release last night, this includes more than 3,600 Iqaluit with at least one dose and 2,000 Iqaluit with both doses. I know a lot of people are very worried and anxious right now. That's normal. But now is the time to be strict with the following public health measures. Stay home, stick to your household bubble, and wear a mask. It is essential everyone do their part to slow down any potential spread of the COVID-19 virus. This will be a community effort and means we're all in it together. For months, we have been asking Nunavut to be prepared and not scared. Now is the time to prove that. We need to learn to live with COVID, and that means being safe and avoiding risks. We can all look to the dedication, patience, and hard work of Iqaluit as our inspiration. We can do this, and we can, and we will keep one another safe. Don't take chances. Don't risk your health or the health of your friends, family, elders, and your community. Nunavut, if you haven't already called your local health center to make an appointment to get your Moderna vaccine, do it now. It is also important that you go for your second dose appointment to ensure that you get the full protection of the vaccine. I will now turn it over to Dr. Patterson to let us know our next steps. Stay home, stay safe, and stay well. Thank you, Nunavut.
Ready? Good morning. Last night around 8 p.m. we confirmed a positive case of COVID-19 in Iqaluit. This individual is an exempted critical worker who has been in the territory for about 16 days and became symptomatic roughly 2 days ago. This person was tested yesterday through Iqaluit Public Health. Based on the time frame, it is possible the individual contracted COVID-19 in Iqaluit, and we have a team from Iqaluit Public Health contact tracing to identify any other positive cases of COVID-19. Effective 7 a.m. this morning, Iqaluit has been placed under our strictest level of public health measures. All non-essential businesses and government offices must close. Indoor gatherings are restricted to 1 household and 5 other people for emergencies only. Outdoor gatherings are limited to 5 people. All indoor public gatherings are prohibited, and schools in Iqaluit will be closed for the remainder of this week, and masks are mandatory.
Ulasakut unulauktuk 8 miunnukut nalunayak silauktugut nalunayak toyohan nga inuvadyo anak 19 ling ikalunni. Tana tikititaw yuminik anitteili kay nakahakanik kanayakak tuyakalakin ning ano tamani nunavumit si malektulo ni 16 nik ambalo kanoy gutahapalya lauktu makulo na si malektu. Tana ipatsyakaw isaktamin ni ikalunni kumain ni abimi. Ambalo hangakku si maningata kullugo tana nuvadyo anak tam si maningak suriyaw yok tamani ikalunni. Ambalo piliri khatige ni tamani ikalunni kumain ni abimi katiyaw yumining nakawisak palya laktut. Tako asingin ni pitahang ikalo ang mga sa mabiyo si mayoni. Pigyak to ni ulak sa ivami ikalun ni tana asago behang ito na ham nang ituliran na mumalitaw yalin ni pigyak titsikhaw yun. Tako pitahang atong ito namin nakaktiyo yung gavamakulo alabang ipisiraw takakaya atong ito matugyalin. Ilo ani katisiman ni uyo tako isulitar behang na elektut ang malutako illu meo khatigi khakan nga gutalle manipula ta gunnarlo tikisani tuaver nartukun sila mi kati mahatam na tuta ko talle may na hattagun nak illu meo khatigi ngitut amalo illu ani ta ko kikkutu na katigi akharun ni tsartun ilin na bili ma yakhalun ni matumane alak tutabani pinasa ko siya me akko ngani amalo matuak si magakhakto si asago behang itukun.
Qikiqtani General Hospital is reduced to emergency services only, and clinics will be virtual with optional in-person visits at the clinician's discretion. If you have a non-emergency medical need, please call first, and more information on service changes is available on the GN's website. Because Iqaluit is a travel hub, travel restrictions will do more harm than good. To reduce the risks, we have increased restrictions across the Baffin Region and in Rankin Inlet. This means businesses in those communities may remain open but must implement strict social distancing. Indoor gatherings are restricted to household plus 15 people. Outdoor gatherings are restricted to 100 people, and indoor public gatherings are restricted to 50 people or 50% of capacity, whichever is less. Schools in these communities will move to stage 2 of the education plan.
Riketani anna bealok tako upatta hatta jagu ni to avernaktu no kisiani amalu tako anna bela hatta to khariso ya ko kisiani upa hatta tako ya hatta unnamne atu tako lutangi khanu ili romani malittugin to avernaktu kungittu tema anna bela ko khaya harovit okhala khatallusi to kisiga kanne unnaktu sitamakko pe itsirauti asijekta yutako Nunavut gavamakkungita khariso ya ko to kisiga bengani Taman na Iqaluit aula khatartu no tuttabiu ninga no takwa aula khatam nang mo isulit tabiu yut akaw na ako takangim gayangim mata kasi ani uluga nak tumilo atay litit siluta takwa isulit tabiu taks mayavu hikita lummi ammalukang yasinami taman na tukili namin na hatiu yu suli matuing agun naktu galo kasi ani atulirtis sigalit asago bihangit ni malitaw gali ni inu khatigi khanigilo atay lakatagaham ni Illu ni katima khattagun naktu takwa illu me khatigit amalo 15 khakan ningagu sila mi katima khattagun naktu takwa isulit tabehat na 200 ning illu ani kati khattagun naktu takwa isulit tabeham na 50 nut ubalo abang ita tatsuma illu le khagun nam ningita illuin inu khagun nam ningita nalle mi kinaksaw yu malitawluni ilin na mili mata ko tuliani makko tu mi takwa ilin na tuliri ko pamnautingani atulaktit sinakto
If you left Iqaluit on or after April 13th to another Nunavut community, you must isolate for 14 days at your final destination. Vaccine clinics in Iqaluit and in the communities are continuing as scheduled. If you have an appointment already scheduled, please do not call to confirm. Attend your appointment as scheduled on time. Please go alone and wear a mask. I urge everyone to follow the public health measures. Following the orders will help us contain and eliminate this outbreak as quickly as possible. I also urge anyone who believes that they've been in close contact with a positive individual to immediately isolate and self-monitor for symptoms. If you are identified as a contact by public health, please cooperate with the contact tracing protocols.
Iqalun ni ngalaw na COVID April 13 mikingun ni agullo ni asing ang Nunavut minunalinnut anit tayliga khalikuti ullo ni 14 nunat sinni. Takwa kapiyaw hattaktut iqalun ni nunalinilo sulikayo siniaktu tayo matsayin na. Init sa COVID takwa init sa liyo tawagir si mag-COVID ukalagi atong ito tinalo na silutit. Upatuin na lutit init sa liyo tawagir si mayamnut ang maluking ubang ilutit inutulutillo matuak si matsar lutillo. Ayaw tuya kakikkulima malit sa kullugan na hamnang ituloy ng mamalit daw galinnig. Takwa malit daw lutik tayo mga siya magtaylitit sigun na ni aktugo taman na kilamiw na sakko siya magtaylit daw gun na kullugo. Ayaw tuya kivag kakikkulima tayo kwa katiyakak suminiw surigutik taat sumunga nuwadyo anak taak sumayumut anit taylit saw tigi gali maan at saw tigi naminaglo kawya sak lutik kanuigo tikak palialing ikalo amamig. Nalo na tao si magovi katiyakak tuminiw ng mut anaham nang ituliri kunut nalat siya na akuti takunu nga katiyaw yumin ang nakawi saktinut maliktaw ga ako yaw si mayuni.
If you have COVID-19 related questions or believe you might have been exposed or have symptoms, please call the hotline at 867-975-8601 to speak to a nurse. Please reserve calls to health centers and the hospital for emergencies or other medical needs. Remember, no one wants to get COVID-19 or to spread COVID. This is not a time for blame or anger, and the best things we can do is follow the public health measures, wash our hands, stay distanced, and stay home if you are sick. Thank you.
19 mo to ha ngayon ni kapit ko sa COVID o balon ni tayo mga katiyakak tuminiw so kayo binuwadyo anak tulami o kalagon na tutil uvo nga kikang ito nga situmi 867-975-8601 ana si optimo ha kumanakarlutin o Ukalakat tuhalo ako yingitut anar bimut anar balon nullo kisani to avernak tuharovin asingin nullo ni inulisak tawga harovin. Iqamane ako si kinatuinak nuvadjuanak taro mangiman ambalo nuvadjuanak mixer masigo mangiman. Mana yo pasit sige si magyakaron ni sa tigut ningan na hatay lilutalo. Tayo malakaw nagpangunala kumalituin ng lugit ako malitaw kuyaw si mayot. Agkasiwasay ng lugit inukati sinikatis Hanigi Iqaluit tayo lusi ang maluang ikak si makatar lusi hani matuarot si. O yan namin.
Ublakot Nunavut miut. Dalo nang itong ikalong miut isumarog mataangi yung nuvagjuang nagtaka laktid lugut agbani nunalipaw yaw iluani. Kasi ani kaway makubapsi. Tako pilare yigiyawut aksok lutik pilare sikaw tigilaw tut unnuk. Taman na kaway nasusikaw tigiblutik. Kina nuvagjuang nakang mga ituniglo kanitakalaw ng mga Tamatumu nga pang nagsimayo to kawak dulirap tayam na ito kakayang ninganut. Tako inuit ulo ko yan aktumir kong inaptigo. Apirebo nga nun ikalong miyunik nun na bumiyunik lo. Uy maya ako yung nga. Uy makoy na nga lo. Pilari yun nakto tamatumi nga pilari akang mata. Akso ko sikaw tigilaw tugo tamatumi nga pilari akakasukto ta unno. Good morning. I know the news of COVID in Iqaluit has people in the city and the communities concerned. I just want to reassure everyone that we are working hard to identify and contain the virus. This work began immediately last night when we found out of the situation. We have planned for this, we are ready for this, and we will do everything we can to keep everyone safe. And we ask in return that you do not panic. This is not the time to panic. Narunak silang at tao, niwer vingnut, niwer katatlaro yahanik, nungod jaw nginip sin ni sunamianik, ato kataktap sin ni ubdutamat, tayo man na iliw ko nga. Niwer excited nungod la jang itut, tamakwa niwer sa waktu ubdutamat, tayo maungin ng neaktut. Niwer kataluang nungod jinerlo, tamat kuning apiyari akaktunig, ino katiptin nun, aksong naktungat tituin na sung mata. Ino katigit yakta, ikayo katigit lutalo, ang mapiluak tumingtakuan na yaktay di mayulari ikut maligalyara si mayangit malitsyar labot. Tamak kuning ang matuarnik, niyore ikutinig atutsyar at takta, ang maagabot, ang migayuk sa simalaw pitlagay akang nayaktabot. Pilay katigit lutataman na, sa halagi yun nayakap tigot. In closing, I'd just like to ask that there is no reason to rush to the store and begin hoarding supplies. We have enough supplies for everyone. Their supply chains are not affected. Hoarding will only hurt those that cannot get to the store before you. Please, let's be kind to each other, help each other and cooperate with public health and follow the orders. Please wear a mask, wash your hands more frequently than you normally would, because together we could get through this. Be safe and thank you. Kuyan namin.
Kent Driscoll, APTN National News. Dr. Patterson, maybe it's too early to know this, but I'm wondering, the COVID that's here in Iqaluit, is it regular COVID or a variant? And if you don't know that yet, is that something you look into or does that matter?
Kentus ko ipitihan ko niluta Patterson kila miuluak tut sa yoga luak kisani taman na tana nuwadjuan ak tak tumini kalunni nuwadjuan ak tutuin na wa upalutay nasid si padla yo sangi ni uva sangi yo na sa yo taman na kanu kaway saktaw gunna niya ka.
Yes, a portion of the sample will be sent south for the genome sequencing to see if it's a variant or not, and those results will take at least a week.
Dat si makaway sakat sa ilang halo na naulak titaw na ato tayo makaway saktaw siya kaya kanirlo ni tayo makay pinasa ako sinasimalik ka to kisigong naksilar tabo.
Dr. Patterson, you covered vaccines and you covered how people should be dealing with the hospital right now. I'm wondering, are there any anticipated or upcoming changes to expedited medical travel or medical travel out of Iqaluit?
Luta Patterson tako kaputi mit sano kalimakhaw gabi malokan kamagiyahang mga taan na biliakat takto kasi nilikia kanuniri unak katako kilami yukuan na bimutikis awlak titaw kay nakatakto malohan na biliakat takto kalun ni kanuilinga kay nang nilikan.
We haven't made any changes to those at this point. We're still doing the risk assessment, and we hope to have enough information to make a decision in the next 48 hours.
Mana taman na si Diyos si Madyangi kay nakto taman na ulo kaya nang ningan ni sulikaw isak paliagat tukisi umat siya likot tayo kay 48 na sumalik kata taman na kawigakan ng naktab.
Jackie McKay, CBC News. Are you able to say if the individual was interacting in the community or was linked to any events that were happening in Iqaluit? Something that comes to mind is the NERB hearing.
Jackie McKay, CBC, kung yung ako nakita na ba dyan naktas mayo nung nalinoy katalaw mga namong katalaw mga kubalota ko ano na ba may mayo lagi ko katimani nga nalat tilugitay kaniya kataw si man naka.
We're not aware of any links to public events at this time, but we've known about this for about 14 hours, so hope more information will come out over the next day or two.
Taman na kayo mga itabo suli tako kikod nila kikutuin na isangan ni gayak ng mga tan na kayo simalitay na katigwi ka kani 14 nik tukisiya kanila ulutaw ulutaw smakulo ni nas malakati tukisik kanang nakalwakto.
Many people are here currently for the NERB hearings or standing committee on legislation. From people from outside of Iqaluit, what are they supposed to do and will they be able to return to their communities?
Tako agigo ami sumani matano na bumiuma ila avatili ko kati matilugit amalo tako maligaloti maligalere nang kati mayagala tamani mata tamani kalunni awla kon naksina kabalo kanin na katamakwa.
If they don't have symptoms, they can travel, but if they're traveling to another community in Nunavut, they're required to isolate for 14 days from when they left Iqaluit. If somebody has symptoms, if they're feeling unwell with a cough or cold, then they need to get assessed before they leave town.
Ano iguti hangito akata awla kon naktu galuan tamani Nunavut iloani kisani asingin nunalen no na uti tayo mano na nunamin no tikikuti ullu ni 14 ani teliga khayaktu kisani hanu iguti hatu uti tayo ma awla kaya hangito khawi sakta ut sa langin ningin.
Mathieu Sarvé, Radio Canada. Can you be a little bit more precise in terms of the contact tracing you've conducted? So maybe like how many people you think might have been in contact with the positive case?
Mathieu Sarvé, Radio Canada. Kuni nalunera kanil nakita ko katiyaw si mayo khawi sakta waliani khatsi mga tatana misuni kay katiya hak dumini usuriyaw ba.
There were more than 10 people identified last night, and contact tracing obviously is continuing on right now, so that's as of 11 o'clock or midnight last night.
Huli yung atani tutako nalinak taw si mayo unno laok tutay makatiya hak dumini usuriyaw lutig taman na kayo sinikanga katiyaw yuminang na kayo sakpalian ng itako pigya laok tuti unno ili apame umbalo kulani.
Thank you. Are they all in Iqaluit?
Yeah, everyone who's been identified so far as a contact is in Iqaluit.
So with the third wave in the south and the spike of variants all over the country, even in the other territories, how are you going to make sure that other critical workers don't bring with them COVID in their territory?
Tako abi ngayon ni sa mapalay lakilot tilugi kanatami amalo tamako sangilak palay inowadyo na yasingin ni kanatami awito si maniyo yunilo kanulita ko kamagiyaw na kanaya tulaki gali tikikatak hamning.
So first off, we're not certain how it got into Iqaluit. We do know that, and it's been publicly acknowledged that the individual is an exempted worker. but they were already here for 13 or 14 days when the symptoms started. So it's not certain that they brought COVID into the territory. I'll let Uli interpret that and then I'll carry on.
Sebulan mila tema suli nalo ang akano taman na halong nutikit tumini ninganik kisani nalo na sisimayugutan na kanaya reaktor simayo ani teliga kakain na simaningit tikilaw ningini tan ulo ni 13 ni 14 ni luni tamani lektumini kanu iguti hakpalali tay nalaw tos tay may manalo nakto kanu taman na nuna bumutikin ng mga suli.
Our first priority, as always, is test, trace, and isolate in order to stop the further spread of COVID-19 as soon as possible. And that's where staff are focused right now. If in the course of our regular contact tracing and case management, we find ways to alter any of our protocols that would reduce the risk of introductions, we'll do so. But right now, the focus is on stopping the spread as soon as possible.
Sibuliumitan na sibuliutak panginakat sibuliut nyakatigo kawi sa katamne kamalu ani tailitit sinek ko sa mapalali ko nago kilami uyukun tako yakana yakti taman na tuwag kikane yaktanga tema katiyo yuminang na kawi sa palati lugi tamata mingalo awlat sitilugi tay ma kawi ballago tatu kisiballago ta asid jira yakta tamak ko malitaw gali kisani manna yuto aga halong waktu gustang matailit sinakmi.
I'm trying to the Canadian Press. To follow up on Kent's question, what's the turnaround time for testing for the variant?
Emma Tranter, Canadian Press kunni Kent apek kutigata tangata ko hawi sa kutiyo yo hanutigi tay mautakiga hakauti lang aluna kutiyo.
It's at least a week.
Pinasa ako sila magalammi.
Some jurisdictions in the country will identify where an infected individual has been in order to notify others who may have been there and could possibly have been exposed. Are you planning to do that here in Iqaluit?
Ilangin na ito si Maviyo ni nalo na si katang at tatamak ko as nupadyan actually namin ng mga takaw yung kay Lutia si Minitay ko pataw ito yung nakaeliminang ni taman tayo may leong nakita man kalun.
If we identify exposures where it's impossible to know that, that a bunch of people were there and we have no way of tracking them and doing the contact tracing directly, then we'll do those mass notifications and public announcements that way. The same as other jurisdictions do, but we don't have enough information to do that at this point.
You're talking fast today.
Sorry.
Dalo na sigut tata nakikun ni katiya haktumini yung mga tay man nakaw yung manangit siyang kikun ni katiya haktumini yung mga namihata ng mga loni tay ma kaw yung salaw tiluta katiya miningin ni amisunit tumini yung palu tay ma dalo na sigum nangin kuta kaw yung kay gayak tigo namit tumini yung mga kaw yung simalikot ta kisani ito kisiga kat siya kakata sa bulami.
News. Does the size and population of Iqaluit pose any additional challenges that your team didn't really have to face in contact tracing or potential outbreaks in smaller communities?
What's your name again?
Melanie Frashant.
Melanie Frashant. Nunat sa news ko nita na ikaluyangin ko ngayon tamakwala misu mata katiyakap tumini yung mga takaw isaktaw gali sila tanilitaw kaluyakan taman nakamagayaw na ka.
It's going to be different from other communities for a variety of reasons. There will be, there's greater potential for more spread, but there's also greater resources and there's also easier access to, in many ways, support mechanisms and alternate places to isolate. So we'll have to, bottom line is we carry on with our job and stop the transmission as fast as we can.
Ini taman ila adjiu dang ito asing ni nunaliniw si mayo tay malo amisunik sanu sa magunak to ni nunalipaw yaminik sa ugata tay may malo kasi ani pili kadyo chakat siya nagsaulo ta malo kayo tit chakat siya nagsaulo ni tamani asingin nilo ani tay liviw gunak to ni pitaham nagsaut siya to ta kasi ani litan na pimariw nakpango tay makayo situin nam na to pili kaya igalit ni taman na siya mapalya tay likulog.
And can you confirm whether the individual who tested positive had received the COVID-19 vaccine?
Dalo na sigun nakita na Nunavut naktaksi manirataw yo kapiyaw si mamanga
No, I can't.
aga.
Trevor Wright, Nunavut News. I think it was a response to Matisse's question, but you mentioned that they were already here for quite some time before showing symptoms. Is that a cause of concern in Iqaluit, for Iqaluit residents? Or?
Trevor Wright, Nunavut News kun ni Mati sa perikaw yung atan na kun ni kalan tramani sa tigi sa may yuminulo at taulo ni taman na kayo sumalo tayo kaya kakay kalumyo.
So it increases the chance that this individual actually caught COVID-19 in Iqaluit, so there may be other people who've been infected, which is why we've, as we've always said, if there's risks of community transmission, or if there's risks that community transmission has already occurred when it's been identified, we go straight to our most stringent public health measures and do the work to figure out if there's already been community transmission.
And
Wait. Taman na ilay, piviham ni sa ugayak to taman na ikal Nunavut naktak to minuto in nakahamningan ikalun ni tayo matigi tamani ko talang ningan taasingin nilo Nunavut naktutak si mayo katuin na kayali kambalo nunalin ni siya maksima pali atuin na kayali tayo may masangin pa ni malitaw gali na hamnang itulirin ng matulik titsaw tigibugo kawi kaswaksin na ni tinitamani nunalin ni siya maksimang ikalama.
And what point along those public health measures are we at right now?
Say that again?
In response to Patterson's answer, no. Like, are we at the most strictest measures right now? Or?
Oh, okay. Tako ana hamnang itulir rin ng mamalitaw gali man na kut tinakpangan ipan sang ninakpangan ni.
Yes.
You don't need me then.
Kent Driscoll, APTN National News. Dr. Patterson, you said masks are mandatory. Is there going to be any enforcement to go along with that hope?
Kent Driscoll, APTN kun ni matwak si magaham na kay kauga biasa agwag behang itukut malitaw kay nang mutay malitaw kay gaya kalaki lang abisi kawi sa katalos eh.
Yes, if needed, and I've already heard that many retailers, stores are requiring masks to even get in. There's a number of ways to enforce it, and if we would follow our usual process, we'd issue warnings first, and if it becomes a recurrent problem, then consider fines.
Tayo may gaya hakuta tayo mali to saksi malirat ni ubik bin ni matwak si khatara khalain ninginik isang na ato ako tig amalwad jiging ito tigo taman na malitaw karon na tigo tayo matsay nak solo sibulo me inakto igala ulo ta malit nalang ito inakatakilitit sigun na kayang meyugo.
You mentioned that the person who tested positive was an essential worker, meaning that they didn't have to go through the quarantine to get into the territory. There are rules essential workers are supposed to follow during those first 14 days, though. They're supposed to wear a mask in public. They're supposed to avoid public places. Basically, it's a lesser version of self-isolate. Do your job, go home. Did this person follow those instructions?
Ukakaw ilatan na ilan Nunavut naktas mayo tayo may kanayak tiuningin ikanayak tiuningan ni kamaluan itay ligya kakam ningin matikilaw tinago tako tikit sa kaya katak tumalikat kaya hangata tikikata tilugin Nunavut mo ulo ni 14 nikso lumatwas si may nakataka hasuti kamalo tayo ma hamisunu tayo ligya hasuti tayo mata na tayo matsaya malik tuminiw galawa kamaligyaling ini.
At this point, we don't have any information to say that they didn't follow the rules.
Mana yo tukisinak to kang ito ta na malit sa nakalawa mga tako ni nga malit taw galim ni.
Jackie McKay, CBC News. The press release said that 3,400 people in Iqaluit have had the first dose of the vaccine. In 2,000 have had a second dose. Can you clarify if the people who've had a second dose are included in the number of the first dose? And how protected are people who've only had a first dose?
Jackie Makesi, BC Kunita, Pivalla, Yulerin to Sakti Siguti, Naluna, Simakau Mata, 3,400 Iqalum Mute, Sivulapa, Mikapia, Simalerning, and Malutako, 2,000, Tuliani Capia, Simalerning, Nitako, Tuliani Capia, Simayuna, Sakta, Simabata, Kununga, Sivulak Mikapia, Simayuna.
Yeah, it's 3,400 people in total. Of those 3,400, 2,000 of them have received 2 doses. About 2 weeks after your first dose, the risk of getting severe COVID-19 infection is decreased by at least 80%. 2 weeks after getting the second dose of the Moderna vaccine, the one that we use, the risk of getting severe COVID-19 infection is decreased by about 94%.
Tako katilimatugi 3,400 kapiyaw si mayuk tako alo 2,000 tuliani kapiyaw si mayuk tako nung ilagiliw jaw si mayuk. Tako sibulak pa mi magrupi na sa ako si kapiyaw lolo ni sibulak pa mi tayo mga ulukan at tumigon nang ni nga kani magutakhalaki gun nang ni Nunavut nang mi 80% mo katagun nakhatakton. Ang malo 2 weeks na si malak tilugi Moderna kapiyaw lak tilugi tuliani tayo mga kani madyaron nang ni 94% mi katat si mabalarong nakhatakto kapiyaw si mayuno.
And we know the Moderna vaccine doesn't protect against all variants of the virus. Once the variant of the case is known, will you make that public?
Tana Moderna kaputiyo yok tayo magu ilangin ni sa pagmiyaw gutiyo gunang makani magsangi yok pala ayun Nunavut anak mo. Tako asit jika yakigi kaw yigut siyo taman na.
Yes.
Ay mga
Don't you dare.
This question is for the Premier. Maxi Sarvé, Radio Canada. So Iqaluit schools are closed until tomorrow. What's the plan upon that, and how are you getting prepared to for the next phase?
Mati Sarvé Radio Canada kun ni sibulak tita ko yakalun ni ilinabi matuyaw si mamata kaw pamuno kano palungayak si manak kataman na.
Thank you. When professional development days in Iqaluit are done, Iqaluit schools effective this morning were on stage 4, and stage 4 means that all instructions will be conducted remotely, and all schools are closed to students, staff, and the public. And I know the school staff have we've been in this pandemic for about a year now, so they've all been preparing for incidents such as this. Man ugla pigali wuta ko akalung nilin na with stage 4 mut nukta na mata kaya man ilin na ngitu ulata ko ilin na ti ta ilin na mata mana dan stage 4 ilin na may tabanya kalung ni tukikak to ta ko ilin na wi lukta ukwa kemanian mata ko ilin na tu ta ko ilin na ti ilinaw yung pilarayo ang takwa inumeluk tano ukwa manata ilinaw da kalu iloni.
Are any additional resources going to be allocated to the schools?
Hakan ni ikayutit sa ni pilarayo sa ni ilinaw bito ni yaw lang aman.
Takwa panakhiman law mata matakwa pilarayo na mata. Takwa ikayok tayo kanarang nakpata tayo maunam ikayutik kat. I know the schools have been planning for this and they're prepared for this, but if any other resources are needed, then we'd look at that.
Next question would be for Dr. Patterson. Can I ask, or do you want me to wait? Emma, do you want to go?
I'm wondering what happens for those who are traveling through Iqaluit. I'm thinking of people returning from isolation hubs who might have a short stay or a one-night stay in the city. Do they have to isolate for an additional 14 days?
Ama Trantra Canadian Press Community Qualika Tiki Hatarnato, Iqaluit, Akusa Hatarnato, Halunani Artumini, and Italika Namiko, Iqalutigo, Sulu, Noatuina, Akusa Nerlutang, Uluni 14, and Italiga Hanarivan.
Right now, if you've just passed through, like just a brief layover or even a one-night stay without going out visiting, then no isolation isn't needed. As we get more information, if we have to change that recommendation, we'll make announcements at that point.
Man now your tema Akusa to Namno, Halutigo, Unwang Namlo. Ako sa man nerotik tayo man lo pula kalaw ni serotik tayo man nunamin no tikikuti ani teliga kakayang nito kasi ani to kisiga kan nerot taman na sa jito na kayali.
We would say that anyone who has passed through Iqaluit, best thing to do is self-monitor for the next 2 weeks. So if they feel sick in any way, immediately isolate and contact their local health center or contact the hotline for advice and assistance.
Kasi ano kamayo kasi ani Iqaluit tigot ako sa tuminyo yo hakatay mama na yo imini kay sa siya ko yo kanoy ko tikalingi kalo mga mi pinasa ko sini makuni kay ma kanoy ko tikasuri ko tikani mapalya ko tikana bimo kala chau tigali balo o kala lo detach mo nga kangit mo nga situmi.
Are you able to rule out the possibility that this is a false positive?
Dana tamma ko taw sa maningani nalo nang ito tamma ko taw sa mangito.
Yeah, it's extremely unlikely that this is going to turn out to be a false positive. The individual had symptoms consistent with COVID-19. The lab, before they even called me, the lab techs had run the sample more than once, and they've now run it on 2 different instruments, and they're all positive.
Nalo nang itsa to tahan na tamma ko taw jangin ninga ni tahan na nalo na taw si maninga no vadjo nak to hang ninga ni tahan nalo kano igut khalaw nga tay matsay na no vadjo nak ta sa mayo kano igut ta khatam ningin ni tay na wi sebe me khawe sa big tay mata chumo khala law ngin ninga ni alla makwa te khawe sa lekto mini yamalo makun no khawe sa ko tiyo no khawe sa nga tatana nalo nang it tamma ko taw si mangin ninga ni no vadjo nak to khalakin ni.
Can you please confirm what the process is for workers who are deemed essential and exempt from the isolation hubs to come up? Are they all tested before coming up or upon arrival?
Melanie Rashad nunat siya kung ni tako kano atwag taw katamakoy kanayakti anit tayo kay nariyatong mitut kaya saktaw kakatak no vadyo anak to hangi kalo mga ta.
So they have to file, in most cases, they file an application for the exemption. We do review their travel history and exposure history. Anybody who's known to have been exposed to COVID-19 is not allowed to travel until their required isolation period has ended. I'll let Uli interpret that part.
Tako tunis sa katayali tut sa raw timig tay mang anit tayo liya tungin nakakumalutik. Tako akimik ko yaw sa katak to na mo awlak si mayumini yung mga tao balo tay mga katiyak at tuminingi kalo mga tano ba jo anak tulinik katiyak at tuminingi kalo mga tay may tuminiuluti tikit itaw ga kakatang ito tamaw nga.
The requirements for their first 14 days in territory are that they wear a mask anytime they're out of the house. They're not allowed to go anywhere but work, and if they're alone once a week to a grocery store to get essential supplies. They're supposed to check in with their supervisor every day that they feel well, and they're supposed to go home immediately if they feel unwell and contact public health. Go ahead.
Tako maliga khatak tu tak sivulla me tiki khatak tillugi ullu ni 14 ni ani teliga khatak tu tamaw nga tiki simalot tillugit amalu namu lima upatangin no matwak simay na khatak yalit asingin no reaqangittuut iqqanaajarearlutikisiani pinasaarusitamaalu atausiarluti inneqitaariartuqattarunnartuti niingerbinnut ammalu qauyikkaiginnahattariali angayoqqaaminnuut qanuinginnerarlutik ammalu qanuigutaqallituaruti taakkuangeqarsimatsautigirrujauqattartum.
And they aren't routinely tested for COVID-19 if they're asymptomatic.
Asymptomatic.
Yeah, if they don't have symptoms.
Okay. Taakkuatau nuvajuarner 19 hangikkaluamanga taqauisartauqallianginnaqattartu qanuiguti hangikkaluartillugu.
And what are the rules for testing in Iqaluit right now? Can people who aren't showing symptoms get tested if they want to, just to be safe?
Qanulli tamaani aqalluni atauga haqqatamakkununga hauisartaugumayunu nuvajuarnartu hangikkaluamangata.
Right now, not unless they've been known to be exposed. For most people in Iqaluit, unless you know that you've been exposed or in contact with one of these individuals, there'd be a higher risk of a false positive. But if anyone has any symptoms, then they should contact the hotline, and we can make arrangements to get them tested.
Maanau jo taakua katijaqartuminiungitu aqata taima hauisartauqatteratungitu tamaani qalunni taakkualu kisiani katijaqartuminiuppata ila katijaqartuminiugaluartillugi taima hauimanartinnagu tammarsimaniusatuinnarngata tamakkuassivullerpaami hauisartaugutiuju kisiani qanuigutiqatuarutik taakkua qaalagunnartu taatsumunga qaalaviugunnartumu hauisartaugumaneqarlutik.
Trevor Wright, Nunavut News. Those who traveled here for the Nunavut Impact Review Board hearings, they've been told to, or asked to isolate in the hotel rooms. Is that something from them or from health? Or?
Trevor Wright, Nunavut News kunni taikua tamaunga tikisimalortu Nunavummi avatiliriyikku naalagiartorsimatillugit anitteili hujaussimamata tujummivinginni taakua nammini taimaatili jaussimayut taakkunangat ubbalo ilinni.
I believe that information or that advice came from the Nunavut Impact Review Board. It didn't come from health. We'll work with them to find out to give appropriate advice and allow people to travel in the near future.
Suliussartunga taakua Nunavummi avatiliriyikku katimayingi taakua taimaatiliссujumini taakkuninga katimagiartuleertuni naalagiartuleertuni aanniartuliriyikkunniingaarsimangittuut kisiani taakua pilirertautsiarunnarniartut tamandahauijautsiarasuarluni ammalu qanu maligiaqammangata aullarpallialaartillugi uqaujutsiarunnalaartagu.
What would you say to someone who hasn't gotten vaccinated yet at this point in time?
Right now, the advice to everyone, vaccinated or not vaccinated, is the same. Follow the public health measures, wear a mask, maintain distancing and separation, and don't have visitors over to your house.
Maana yo teema hautigaqajaqtakka teemaatsainna kapijaussimangittuugalu allu malitsiaqullugi aannaharnanginttulernermu malittauhujaussimajuni matuarsimaqattarluti inuuqatiminillu katisiluattailu ila qanigijaqaluattailuqattarluti.
Ken Driscoll, APTN National News. Dr. Patterson, we were talking earlier about how this person was an essential worker and didn't have to do the 14 days of isolation. And when I asked you if they had followed the rules, you said there was no evidence that they hadn't followed the rules. Is there any evidence that they did follow those rules?
Ken Driscoll, APTN kunniluta Patterson taanne qanaajareartumini anittailikainnarneqa giatunningimaulluni 14 aperiaqhaugavi malinneraloarmanga taakkuninga malittaugialinni kisianili qaujinarsimama malinneraloarmanga taakkuninga.
So the purpose of contact tracing is not to lay blame or fault or to find if people have broken rules. The purpose of contact tracing is to get us the information we need to stop the spread of the virus as soon as possible. So that's been the focus of the staff who started work on that this night or overnight. And so we're not into that kind of an investigation. I'll let Uli interpret and speak about that a bit more.
Tana video te hanga katia minu yuni hawi sakatang na tayo mapasit siga so ako manata pasiyaw si mayo hakto hang ndago taman na lo hawi sakpalya ni katiyaw si mayo ni tukisige ako tigiga so akatigo taman na siya makpalya ni nga nok hakti tao tsaw tigi khulugo tayo mata ko tuwaga hat tsaw tigi laok tu unno apige ang ata katiyaw yuminang ni tayo ma hawi sakatang ito malit to hang nakalo ang mga malit to hang ng ikalo ang mga alaw ni.
The problem with that approach and that way of thinking and some of the comments on Facebook and Twitter already is that it makes it so that people who are exempted workers or people who have symptoms don't want to participate in contact tracing, don't want to isolate, and don't want to be blamed. And that means that the virus is going to spread more, spread further, and spread farther, and will need to be in lockdown longer. So I'll let Uli interpret that and carry on.
Taman na ilakaw ngili ko tiyo yung tayo isumagay yung suwakto kang niakpatakwa tikititaw sa kayo timinianit tayo ilaw tinagit tayo malakaw ngili ko tiyo naksamat ilaw ikayo ka suwakto kang mangipakatiyaw yung minan nikaw yung sakto kang tilugo anit tayo ngippataluni tayo mapasiyaw si matuwa tuwin narlo tayo pasiyaw si magumangipata tayo manalat siya ang ito no taman na siya mapaliakan na rin ng naksama tamalo ako nyo naksama tumagaya kakayak to tatamat ko katiyaw si mayo nalat siya katang ito akata kaya sakto kakapaliatin lugo.
So if in the course of contact tracing we identify places where people whether purposefully or inadvertently broke the rules, we're not going to go public with that because it will do two things. It'll contribute to the blame game, and it will mean that individuals will be less likely to fully cooperate with contact tracing. In order for contact tracing to be successful, we need everyone's cooperation, and we need to individuals need to have confidence that we'll maintain their confidentiality and won't be taking information to RCMP or to the media. So we won't be discussing that.
Tema katiyaw yung minang nakaw isak paliatin luta kaw iguta tako na mga katak tuminiuninginik taman na surlo si kumitsi yung miniw pamalit taw galin ni tamang na to sakti taw kakayang itsak taw tayo mapasijat pasit siga suatu inang ali kaya kata amalutako amalit siya ng inaksaw tuwin ali kayang kata kaw isak taw yung haptilugo katiyaw yung minang ning tayo makisane kayo sitsiya ko tsaka kung nakata tamak ko nga Iqaluit ikayut siya kata kaway sakpaliatin lugi katiyaw yung minangnik ta dalok ko tingin naksaw gaya kata malo tamak ko to saktit siguti jangit siya to kang unak to titaw gaya to palisik kuno hausi gaya ngito balupiyut pivalayo lagayino.
Dr. Patterson, when you start thinking of places in Iqaluit that have a lot of people in close quarters from many communities, first place that comes to mind for me is the medical boarding home. Are there any special mitigation measures being put in at the medical boarding home?
Dr. Patterson, tamak ko ay halon ni katibiyo kayo to amesu biyo katak to tana sigurlak pangum may sumanak to anna bilato no to yung biyo katak to at yung ituk ko tana malitaw galin ni malitaw kakta ba tamata bim.
Yeah, they've had contingency plans for a little while now, and so as soon as they found out about it, they put those into action. Masks are mandatory in common areas. They've increased the rotation of meals so people can sit down up to, like there'll be 3 rotations for each meal so that people are able to spread out and maintain distancing and separation. And they'll be starting to minimize the frequency that people are that they have roommates from other communities so that there's reducing the chance of spread.
Tako li pamnaw te khatso tigi vallali la ngata tay ma ko ni galaw lekto khawi to agami tay ma to lekti sitsaw tigi law to malitaw galen nik so lo sago be khangi tukku matwa simay na ga khasutik amalo ta ko nirin naw tillugo nalikitaw te khatta to ilay nangi tay ma nalikitaw sutita ko ami sulo am nangi mata nirivingani siya maktayo titsinak ngata malo nga sige jo me khatta ko naklo taw chiko khatta kunir te ko niri khatigid.
Jackie McKay, CBC News. Since last summer, has the GN ensured compliance with COVID protocols for people who enter the territory on essential worker status, or do you rely on companies and individuals to follow those rules?
Sakem KCBC kun ni auja niulo tu Nunavut government ni tako malittau gali ni tamakunu ekana ya ratutunu anitteili simangitunu hawisima malitsimangitunu ubbalo tako suli yuritu inartu tako company yut ubbalo ni ticket chau tigisima amanna hanuilinga hattarsima ba.
It is and always has been a complaint-driven process where when we get complaints, we review them and work with individuals and employers to improve understanding and adherence to the rules.
Mangalimata ko solo tatakhaksimayugo unnerluttu harneqatema unnerluttu harneqahawisa hattaksimayut pilire khatawlutilluta ko company yu tamalo qanayaqsimayuta ko malitsaaliqalo mga tamaligialingin.
At this point, can you anticipate how long this lockdown will last?
Mana yo hawi mabi khanutigita ma matumane amangata.
Nope.
Aga.
We'll stay in as long as we need to figure out if there's community transmission. There's a number of reasons to be optimistic that the situation is very different from when COVID arrived in November because we've got vaccine and especially the highest risk individuals are already fully vaccinated.
Hawi ka sa kala kung initin nita ko nunalin ni sa maksimum ni kalo ang mga tayo to sa kami naktuhat sa kataliman na yung November miniula ang ani tayo pilo at tumiyami sunak sa kapayaw sa malangata malulo kaya naktumigon ng naksaya mi sunak sa kapayaw sa malangata mana isumalang nang ninaksaw gayak to.
Matsi Salvi, Radio Canada. On Monday, Ontario hospitals started to cancel all non-emergency surgeries since Ottawa is one of the main southern cities where Nunavut are being sent for medical appointments. Are you going to rely on other southern cities, other jurisdictions?
Mati Sarbi Radio Canada kun naggadyo mi Ontario mi anna beli nukatit sila ng atatawagan ng ito ni pilat tao kata unya to kay naksimane angat takolo upat tao kayo kata to ni Arawa Nunavut mi unu anna beli atunut asing ini nunalipaw yang ni choka behang ngakata nyatut sawa.
So at this point, there's been no impact on emergency transfers. So people who need life-saving treatment are still being, or urgent stuff are still going to Ottawa. For non-emergent and non-urgent surgeries, they're being postponed for some residents of the Baffin Region. And there's no, in many of those cases, there's no opportunity or benefit to transferring to other community, like to other centers, because there'd be a significant wait list already that they then have to go into for there. So we're waiting to see what happens in Ottawa at this point.
Mana yo agama to ina hasimang ito tamakwa to avel naktukko sulu inuli saktaw gali suli Arawa mo tao hatang naton kisani li to avel nang ito tamakwa kapiyaw gali ilangi king over taw si mayut tamanga pilo ato mekikak talo minga si mayut tayo mga pivali ko tahay kayang mata singin no nunalipaw yang no taw gaswa kalo akata nalo nang ito misu matatay ko takayut tayo may mamanaw takikay na tuwin nang naktigo Arawa mekani pala mga ta.
Are you able to say approximately how many Nunavut are affected by this?
O kakam nakikat siya mga Nunavut at sumungatok tao na ato king over tao yun.
Not right now. We know that there's the Territorial Chief of Staff had identified appointments in Ottawa, and we're still getting information on which ones of those.
Kaya nga nalunay jay gaswak pala matkikat siya mga ata 100 nga tani to initsaliw tao sa malaw to ana bila kaya Arawa mi suli nalunay tao sa mga matamana to kasi naluang ito nalya ta ko kinguvareaqta
Start tomorrow morning. We'll be announcing daily case counts similar to what we did when, so that'll start tomorrow.